days in accounts receivable, claim denial rate, clean claim rate. Do these sound like terms only the finance department tracks? What if these RCM metrics are actually telling a vital story about the impact of your nursing unit's documentation and efficiency, a story you likely weren't trained to read? You generate critical clinical healthcare data every shift, but were you ever shown how it directly influences these key financial KPIs? How understanding this data can pinpoint exactly where processes need improvement to stop revenue loss and reduce claim denials. Ignoring the numbers means flying blind to opportunities for real RCM improvement. That changes now. Welcome back to the Healthcare Nurses Network and Nurses Link Up mobile app podcast series. This is Breaking the Code, Nurses Unlocking Revenue Cycle Management, written by Dr. Nicholas Abella. This series is your essential guide, delivering the financial knowledge you deserve to navigate the full healthcare landscape effectively. In Episode 9, we dive into the role of data and metrics in revenue cycle improvement. You'll discover key metrics explained, demystifying crucial RCM metrics like days in AR, denial rate, clean claim rate, and charge capture rate, translating them into meaningful insights for nurses. Your data's impact, understanding the direct link between your documentation practices, workflow efficiency, and these critical financial performance indicators. Data-driven action, how nurses, especially nursing leaders, can leverage these metrics to collaborate with billing, identify bottlenecks, and drive targeted improvements for financial health. Guiding you through these essential strategies are your hosts, ICU nurse James Carter, BSN, RN, and nurse manager Emily Ramirez, MSN, RN. Get ready to break the code. Your RCM transformation starts right now.
Hey everyone, and welcome back to the Healthcare Nurses Network podcast, where we're all about giving you, the incredible nurses out there, the tools and knowledge you need to truly shine. And today, we're tackling something that might seem, a little bit behind the scenes, but it's actually super important for how smoothly things run at your hospital. And that's the role of data, and metrics in particular, in making sure the revenue cycle is as healthy as can be.
That's right. We're going to really break down why these numbers matter, not just in some abstract way, but how they directly connect to the resources and support you have available in your day-to-day work. Because our goal is to help you understand how your expertise makes a real difference to the financial side of things. So where should we begin?
Well, let's jump right in with one that's often talked about, days in accounts receivable, which we often shorten to days in AR. What does that even tell us?
Days in AR basically tells you how long, on average, it takes for the hospital to get paid after providing care to patients.
Okay, and why should we, the nurses on the floor, care about that?
Well, think about it. A high number of days in AR, it means those payments are getting delayed. And delays, well, they directly affect the hospital's cash flow, which is essentially its ability to keep everything running smoothly. Imagine waiting an extra month to get your paycheck. It'd definitely put a strain on things, right? Same idea here.
Makes sense. So where do we fit into this picture?
Your role is actually crucial. Your documentation, or how quickly you complete it, has a huge impact. It's really the first step in the whole billing process. If those medical records aren't complete and accurate from the get-go, the billing team's hands are tied. They can't submit the claims right away, and that creates a bottleneck in the whole system.
Okay. So the more detailed and faster we are with our documentation, the smoother the revenue cycle runs and the faster the hospital gets paid.
Yeah, exactly.
I'm already starting to see the connections here. Now, let's talk about something called the clean claim rate. What exactly makes a claim clean anyway?
A clean claim rate is just a fancy way of saying what percentage of claims are submitted to insurance companies without any mistakes. So a high rate means fewer claims get rejected, and that leads to, you guessed it, faster payments. It's all about efficiency and making sure the system is working as it should.
And how can we, through our documentation practices, contribute to a higher clean claim rate? What can we do?
This is where your attention to detail really makes a difference. Clear, thorough, precise documentation. That's the foundation of a clean claim. Each medication you document correctly, each treatment detail you note down accurately, every patient response you recorded, all adds up to minimizing the chance of errors that could cause a claim to get flagged.
So it's not just about keeping good records for patient care. It's also about making sure the hospital is getting compensated correctly and efficiently for the care we provide.
Exactly.
Okay, makes sense. Now let's move on to the claim denial rate. Why do claims get denied in the first place?
Well, the claim denial rate is basically the flip side of the clean claim rate. It's the percentage of claims that insurance companies reject. And there are some usual suspects, if you will, when it comes to denials. Sometimes it's incomplete documentation, maybe a signature's missing, or there aren't enough details about a specific procedure. Other times, it's coding errors, so the services provided don't match up with the right billing codes. And sometimes a claim is denied because the documentation doesn't clearly show why the treatment was medically necessary in the first place.
And this is another area where nursing documentation is super important for preventing these denials, right?
You got it. Your notes, they're like the justification, the proof for the care provided. They need to spell out exactly why a specific treatment was needed and why it aligns with medical coding standards. The more detailed and clear your documentation, the stronger the case for why that treatment was absolutely necessary.
Okay, that makes sense. So could you give us a real-world example of how good charting could actually prevent a claim from being denied, something we can really relate to?
Absolutely. Imagine a patient who develops a pressure ulcer, a really tricky situation that often requires those expensive specialized dressings and frequent nursing care. If you, as the nurse, meticulously document everything, the stage and severity of the ulcer, what types of dressings are used, how often those dressings are changed, and how the patient's responding to the treatment well, you're building a rock-solid case for why those interventions were absolutely necessary. Without that level of detail, the insurance company might start questioning whether all that care was truly warranted, and they might just deny the claim.
Wow, that really highlights the direct impact we have. Okay, let's shift gears to the charge capture rate. What's being captured here?
The charge capture rate, it basically looks at how good the hospital is at keeping track of and documenting all the services provided to a patient that they can actually bill for. Think of it as making sure the hospital gets credit for everything, every little thing that you and the rest of the team do for each patient. If a service isn't documented properly and completely, it might as well not have happened, at least from a billing perspective.
So we need to make sure that every single thing, all the care, the interventions, the resources used are actually accounted for when it comes to billing. And once again, our documentation is the key to making that happen.
Absolutely. Those detailed notes, that's the evidence, that wound care we talked about, each medication administered, every piece of specialized equipment that's used, any consultations with other specialists. If it's not in the chart, it's like it never happened.
So if I give a patient a crucial medication but forget to document it, it's as if, from a billing standpoint, that medication wasn't given at all. And the hospital might lose out on the cost of that medication and the nursing time involved?
Exactly.
Wow, okay. I'm seeing a pattern here. Now, what about the denial resolution time? What happens when a claim does get denied?
Well, the denial resolution time is just a way of measuring how long it takes for the hospital to deal with those denied claims and hopefully get them overturned. A shorter resolution time means the hospital gets paid quicker, which keeps that revenue cycle healthy and flowing.
And what can we do to help speed up that process?
Your responsiveness matters a lot. If the billing department needs more information from your documentation to fight a denial, like maybe more specifics about an assessment you did or a particular intervention, the quicker you can provide that, the faster they can appeal the denial.
Yeah.
Any delays can really drag out the whole process and hold up those funds.
So we've talked about all these important metrics. Now for the practical part. How can busy nurses like us actually make this a part of our daily routine? We're already juggling so much.
That's the million-dollar question, right? And one great way is to take advantage of any revenue cycle management training your hospital offers. These sessions, they're not just boring lectures about finances. They're actually opportunities to see how what you do every day directly impacts the financial side of things.
And they can really help you connect the dots between your documentation practices and the overall health of your unit, even the entire hospital. For example, they might show real case studies where improving documentation led to way more claims getting approved and more revenue coming in. I can see how seeing those real results could be motivating. Another thing that comes to mind is working directly with the billing and coding teams.
Building those relationships and communicating regularly, that's huge. It helps everyone understand the challenges and needs of each department better.
Yeah, I love that. Maybe even setting up some quick check-ins, even just once a month where nurses can bring up any documentation questions or coding issues they've come across. That kind of open communication could go a long way in preventing mistakes down the road.
Couldn't agree more. And these collaborations could even lead to creating unit-specific documentation checklists or quick reference guides, tailored to the kinds of patients and procedures you see most often. That way, you're always sure you're capturing all the right information.
And let's not forget about self-assessment and peer feedback, too. Reviewing your own documentation and participating in unit-wide reviews, that can be really eye-opening.
Having those regular documentation reviews, maybe every few months, where nurses can anonymously look at each other's charting and compare it to best practices and billing requirements, that's a fantastic way to learn from each other and catch any common mistakes.
And it's important to use that feedback to actually improve. Maybe even incorporate some role-playing into staff meetings to practice charting for tricky situations. That can be a fun way to reinforce those best practices.
Absolutely. And another valuable thing to do is connect with your admitting office or the finance department to get data specific to your unit, like your average days in AR or your claim denial rate. Seeing how your documentation impacts those real numbers, that can be a huge motivator to keep improving.
Okay, so now we know why it's so important to be aware of these metrics and how to get more involved. But how do we actually make this a part of our daily workflow when we're already so busy?
Well, one really helpful strategy is to start using documentation checklists. They can serve as little reminders during patient care to make sure you're getting all those crucial details down that are needed for both great care and accurate billing.
Like, maybe use a checklist when you're doing your end-of-shift assessments to double-check that you've documented everything, like vital signs, medications given, patient education, any follow-up instructions. It can be especially helpful when things get hectic and it's easy to overlook something.
Totally. Another game changer is embracing real-time charting. If you can document everything right as it happens, right at the bedside, using the EHR or WOW, you're much less likely to forget those important details later.
Oh, I can see that. It's the difference between trying to remember all the specifics of a conversation hours later versus jotting down notes right away. Real-time charting has got to be way more accurate and complete for both the patient's sake and for billing purposes.
Absolutely. And finally, don't forget about those feedback loops with the billing team.
Make it a habit, maybe a quick monthly check-in, to chat with the billing specialists who handle claims from your unit. Get their feedback on your documentation and find out what common errors they're seeing.
Those feedback sessions are pure gold. They can help you pinpoint specific areas where your documentation can be even stronger, so all your hard work and the amazing care you're providing are reflected in the billing process. It's all about continuous learning and improvement.
Now, I know what you're thinking. Time is precious, and focusing on all this might feel like it's adding even more to our already overflowing plate.
That's a fair point.
Yeah.
But it's important to remember that tools like the EHR and using standardized templates, they're actually designed to make documentation easier and more efficient in the long run, which ultimately saves you time and reduces the need to go back and fix things later.
Exactly. And the bottom line is this. When you actively integrate data and metrics into your everyday work, you're not just helping with the administrative side of things. You're directly contributing to keeping your hospital financially stable.
And that financial stability translates into more resources, better equipment, and allows your hospital to keep providing that top-notch care to patients. It all comes full circle.
Absolutely. It's about understanding that vital connection between the exceptional care you provide every day and the financial health of your entire healthcare system. You are a crucial part of making it all work. You know, if you're finding this information helpful and want to connect with other nurses who are just as passionate about making a difference, we'd love for you to join our community over at healthcarenurses.net. And you can also download our Nurses Link Up app from the Apple Store or Google Play Store. It's packed with even more resources and opportunities to connect and share.
As healthcare keeps evolving, a good understanding of data and metrics is only going to become more important. It's the future of nursing, really, where your clinical skills and your knowledge of the financial side of things work together.
So by taking the time to really understand and engage with these revenue cycle management metrics, you're actually elevating your role as a nurse, and you're directly impacting patient outcomes and the financial well-being of your hospital.
We encourage you to take these insights and think about how you can apply them in your daily practice. Start those conversations with your billing teams. Look into any RCM training that's available and see how you can make data awareness a natural part of your workflow.
And here's a final thought to leave you with. How can a deeper understanding of these financial metrics empower you to be an even better advocate for your patients and the resources they need to thrive?
It's about seeing the bigger picture and realizing the immense impact you have on all aspects of healthcare.
Thank you so much for listening to the Healthcare Nurses Network podcast.